My name is Dr. Frank Vicini. I'm a radiation oncologist for PrecisCa USA. I primarily treat breast cancer and have been involved in multiple studies looking at the treatment of breast cancer with radiation therapy. Intraoperative radiation therapy is exactly what the name says. It's delivery of radiation therapy at the time of surgery, intraoperatively. Now, to understand the use of intraoperative radiation therapy, one has to go back to the phase 3 trials that looked at breast conservation, meaning lumpectomy followed by whole breast irradiation versus mastectomy that showed equivalent survival. During those studies, radiation was delivered to the whole breast over a period of 6 weeks. It was shown to be equivalent to mastectomy, as I said, in terms of local control and survival. But of course, through the years, we've attempted to see whether or not the radiation therapy could be delivered over a shorter period of time. And so intraoperative radiation therapy has been investigated for that very purpose. In other words, to shorten the overall time of radiation therapy delivery to make it easier for patients, obviously, so they don't have to come back and forth after their lumpectomy for 6 weeks of radiation therapy. So right now, intraoperative radiation therapy is delivered literally shortly after the time of lumpectomy. In other words, the patient is diagnosed with breast cancer, a decision is made to proceed with breast conserving therapy, meaning a lumpectomy. And then when patients have certain characteristics, low risk features such as small tumor, lower grade, receptor positive, a decision is made up front whether or not they could possibly be treated with intraoperative radiation therapy. And so shortly after the surgery, while in the OR, using a mobile, either linear accelerator or a type of device, another type of radiation machine called Target, a short course of radiation therapy over a period of several minutes is delivered intraoperatively, and the patient's treatment is completed. In other words, they don't have to come back for 6 weeks of whole breast radiation therapy. Now, there's 2 types of intraoperative radiation therapy that can be delivered using 2 types of devices, either the Target, which delivers lower energy radiation, or the Elliott type of trial, which delivers high energy irradiation. They've been investigated through the years. The concerns with doing intraoperative radiation therapy is that the radiation therapy is delivered before the final margin status is known, or the nodal status. In other words, shortly after surgery, a few days later, when the final pathology report comes back, if the margins are determined to be positive, that patient may still require whole breast irradiation. Or if the nodes were positive, that patient may require radiation to the lymph nodes. So they may still require coming back and forth for several weeks for radiation therapy, but that only occurs in about 20% of the patients. Now, it should be understood that intraoperative radiation therapy has been tested in phase 3 trials. And even though those phase 3 trials show no difference in terms of overall survival between intraoperative radiation and 6 weeks of whole breast irradiation, they do show a slightly higher risk of the cancer coming back in the breast. As a result, intraoperative radiation therapy today is limited to very lower risk patients. And if a patient is interested in possibly undergoing intraoperative radiation therapy, they need to have a discussion with their radiation oncologist as to whether or not they would qualify